And joining me now, very pleased to have on with me Dr. Paul Sundberg with the Swine Health Information Center. Dr. Sundberg, great to chat with you today. How are you?
I'm well, Jesse. Thank you. It's good to be with you.
I appreciate you joining me. I always enjoy getting to catch up with you and talk about what is going on with swine health, not only here across the U.S. but across the world, and the great work the Swine Health Information Center does in helping to keep our swine healthy, for that matter. Looking at a few things, I know the 2020 progress report that is now out, that has been released, it's been accepted. Can you tell us a little bit about the report and maybe just some of the background on this report?
Sure. So the center, Swine Health Information Center, was formed in 2015 by a grant from the National Pork Board. And within that contract for that grant, it includes the yearly update of progress. As the Pork Board does grants, if it's multiple years, then you need to give them a report that shows that you've made progress over the years that you've had it. So this was the fifth one of the series that we've had, the most recent 2020. And the Pork Board just met yesterday. I went over that progress report with them and they accepted it. So it'll be posted on the swinehealth.org website today, I believe, very shortly, if not today, but I expect even today because of the interest that there is in that.
Well, let's talk about that 2020 progress report a little more in depth. And I know it's a fairly lengthy report, Dr. Sundberg, but what are some of the highlights and some of the takeaways from that report?
Yeah, so the center is really charged with three things. In our mission statement, there's three things. One is monitoring for diseases around the world, including in the US. The second is targeted research. And the third is analysis of data and feeding back to the industry results from data analysis of health information in the US. So we can go through those real quickly. The monitoring part for diseases, we conduct international monitoring and report that every month. We work with the veterinary diagnostic labs across the country in the US to monitor for diseases in the veterinary diagnostic lab submissions and compile that information and report that out monthly as well. So those two things are big monitoring projects for us. They've been very successful. They're part of our newsletter and they go out monthly and are on the website as well. In the targeted research area, that's a spot where we could talk quite a while, because in the targeted research area, we've really got a lot done in 2020. The targeted research includes African swine fever and research in Vietnam, the practical finding out the practical pieces about management and control in a country that's actually having the outbreak rather than doing it in a laboratory. We've done work on PRRS and PRRS biosecurity. We've done work on national risk assessment, looking at the national picture for the pork industry, all the way from imports of food and pigs and products and anything that comes into the industry to domestic things like marketing and pig movement. We've commissioned that national biosecurity review. That's commissioned. That isn't quite done yet, but it's a big step toward preventing disease. One more thing that we did that I think that's going to help us prevent disease, especially with African swine fever, is we were able to update the research on the half-life of African swine fever in different feed ingredients, and that gives us a new holding time for allowing that virus to degrade before it gets into the pigs. And so it lessens the risk of ASF. Finally, the analysis part, the Morrison Swine Health Monitoring Project is a project that is maintained by the University of Minnesota. It has more than half of the sows in the country that are sharing information and providing weekly updates on farm statuses. We've used that to do an analysis of PED outbreaks and looking back at PED. So what we've ended up with is a model that we can now predict a PED outbreak on a farm 2 weeks ahead of time before it gets there. Imagine that. We can, my career as a veterinarian has too much been about chasing diseases. Now, with this type of analysis, we can predict the disease is going to happen on a farm 2 weeks from now, so we can stop it from happening. Big step forward.
A lot of big steps forward. Such great research and insights from the Swine Health Information Center with the 2020 Progress Report. Dr. Sundberg, I'd like to talk a little more about African swine fever. We've been studying this and following this for quite some time now, and I know you guys have been doing a lot of work on this. And you mentioned the Vietnam research, and we look at China. We've heard about a lot of outbreaks there. We keep hearing that they're rebuilding their hog herd rather quickly. What is maybe kind of an update on African swine fever globally, especially in those Asian countries?
Sure. Well, let's go to Asian countries first, and then we'll go to Eastern Europe. The Asian countries and China and Southeast Asia, they are trying to rebuild their herds. So that's a big priority for them, and they're having some successes with that because primarily what's happened with the ASF outbreak. Any success around that has been success in consolidation, and that consolidation puts the pigs on farms that have focus on biosecurity. Their big issue initially was biosecurity, and that consolidation has enabled them to do a better job in biosecurity and keep ASF off the farms. That being said, they're still a long ways away from repopulation to the spot that they were. So there's a lot of work that's going to be done there. There's a lot of lessons that we're going to be watching and we're going to be learning from that whole effort. Repopulation is underway. It's a tough process for them, and they've got a lot of work yet to do. As far as Eastern Europe goes, there's now a fourth center in Germany where feral pigs have moved from Poland into Eastern Germany. So far in Germany, that virus is still in the feral pigs, and they're working on trying to eliminate it, but that's going to be a very hard row to hoe as well. They have a very dense population of feral pigs, and once ASF gets in there, it's going to be difficult to get it out, and it's going to remain a threat for their commercial production.
Well, luckily, ASF has not reached the U.S., and all this great research and work is helping us to better understand the disease and combat it if it ever does reach the United States. I know looking here at home in the U.S., we've heard more rumblings about PRRS outbreaks, especially parts of North Carolina and then towards the Midwest, Illinois, Iowa, Minnesota. Can you share any details about that and maybe some of the things you're hearing with PRRS?
Yeah, this is PRRS season, number one. So yes, there's going to be PRRS outbreaks. PRRS goes through a seasonal pattern. During the summer, it's at a low. It increases during the fall and winter when the barns are shut up and the ventilation systems are a challenge. So it's not unsurprising that there are PRRS outbreaks that are happening. However, there is a strain of PRRS right now that is going in Minnesota, especially Minnesota, Iowa, the Midwest, that is, it's not a new strain, but it's causing new problems. And it's being more pathogenic than it had been previously. It's called a 144. And we've known about it for a long time, but it's one that's become prominent in the Midwest this season. There's going to have a few meetings about it. We may be hearing more about that in the coming weeks, helping to report some more about the 144 strain going on in the Midwest right now.
Well, again, I think with any disease, it comes back to having a great on-farm biosecurity plan. And I know that all the research the Swine Health Information Center is doing can help farmers and growers here in the U.S. to better understand and better form that on-farm biosecurity plan, Dr. Sundberg.
Yeah, that's an issue of working with your veterinarian, number one, of course. But the second thing, one of the research projects that we had last year in 2020 that I have yet to have the final report on, but we're going to be publishing interim reports to try to help with just that issue. It looked at PRRS outbreaks in the Midwest. It analyzed PRRS outbreaks in the Midwest and their biosecurity. And that will help us to prioritize biosecurity procedures and protocols that are PRRS specific. For example, what are the top 3 things you should be doing to try to prevent PRRS outbreaks on your farms? That kind of prioritization. That information is not yet totally available, but within the next week or 2, I expect that that'll be coming out.
Well, Dr. Sundberg, it's always great to chat with you. Any other final things you wish to share today?
Well, I think one of the things that we've got to emphasize about the Swine Health Information Center and the pork industry itself in the U.S. is a collaboration that goes on between SHIC, between the National Pork Board, the National Pork Producers Council, the American Association of Swine Veterinarians, and our efforts as well to work with USDA and state animal health officials. This issue of swine health, prevention of PRRS, prevention of ASF, responding to emerging diseases, it's not just a one entity thing. It's everybody working together, and that's something that's been the most rewarding experience in the Swine Health Information Center during the last 5 years.
Well, you can read the full 2020 progress report and find out more by going to swinehealth.org. Dr. Paul Sundberg with the Swine Health Information Center. Always appreciate the time. Thanks for joining me today.
It's always a pleasure to visit with you, Jesse. Thanks.